Hello, this is Dr. David Bilstrom of the International Autoimmune Institute and the Autoimmune Lifestyle, and this is Did You Know? So our clinical setting today has to do with multiple sclerosis prevention. So as a clinician, you have a patient that presents to your clinic, and a young woman, she's thinking about having children. She's kind of worried though, because her mother has been diagnosed with multiple sclerosis and suffering it for many years, and her grandmother had multiple sclerosis, and so she comes to you for overall health, but she also says, is there anything we can do to prevent multiple sclerosis? And you tell her, yes, of course there is a lot we can do to prevent multiple sclerosis in herself. You're thinking about having children? And the patient says yes. And so, well, did you know that in the Journal of the American Medical Association Neurology, 2016, entitled Vitamin D Status During Pregnancy and Risk of Multiple Sclerosis in Offspring of Women in the Finnish Maternity Cohort. So here in Finland, they followed all these women, like 98% of the women that were pregnant, and they wanted to see what their vitamin D levels during pregnancy would tell them about the risk of multiple sclerosis in their children. And they looked at women that were 30 or less, 30 to 50, and 50 and more. Now, pretty much everybody was really low. Ideally, we should be more like 70 to 80, maybe 80 to 90, but they saw that the women that were less than 30, they called them deficient, compared to women 30 to 50 during pregnancy, insufficient. There was a 50% reduction in the chance of the child getting multiple sclerosis in the women that were between 30 and 50. Now, a 50% reduction means we cut in half the chance of the child ever getting multiple sclerosis simply by the mother having a vitamin D level between 30 and 50. But potentially the most interesting thing about this study is that when they looked at all the women, everybody was super low. And so about as high as they ever got typically was 44 in the dead of summer, which is consistent with what we know is that the lifeguards in San Diego are even about 30 points lower than ideal. They're in the mid 40s too. It is so hard to make vitamin D from sun exposure, and this has to do with all the global changes, global climate change. The changes that happen outside the body are the ones that happen inside the body. We cannot make vitamin D well. So the women that were just above 30, 50% reduction in the chance of a child getting multiple sclerosis compared to less than 30. But what they found was that there were some people, some women that were even higher, and obviously they were high enough that they had to be taking vitamin D supplementation. So what they saw when they looked at all the different groups, there was a 45% reduction in the risk of multiple sclerosis in the offspring for every 10 points the vitamin D level went up. So if you took it up 10 points, 43% reduction in chance. You take it up 20 points, 86% reduction in chance. You take it up 30 points, you're above 100% reduction in chance. You're basically preventing it for sure. And so just getting somebody from like 30 up to 60, not even maybe the ideal of 70 to 80, it would appear from the numbers you could be preventing multiple sclerosis in your offspring completely. And later we'll talk about how we can prevent you. And I want to say a shout out to Greta Thunberg for all the wonderful work she's doing in making everybody so aware of climate change. Like I mentioned, what happens outside super affects our inside. Exactly the same stuff goes on. The rules of nature are the same. And just this last week, she organized a march for 4 million people, and then a couple days later, 3 million people. So she's doing a wonderful job, and thank you so much.